So, a new paper came out this week finding that asymptomatic cases of COVID account for possibly half of all new infections. Let's just.
So, if you're a long-standing listener of this podcast, you will recognize that is a shocking conclusion for a paper.
Yeah. Zach, can you put my screen on for a moment? So here it is. It's in JAMA Network Open. I found it through, I'm in I guess it's the weekly JAMA. JAMA is the Journal of the American Medical Association newsletter. And they had this, they had this in the newsletter, and it's got over 200,000 views at this point, which is a crazy high number for a scientific paper. But we were talking about over dinner last night. We don't know what views means here. So I guarantee you 200,000 people haven't studied this paper in the kind of depth that I have, for instance.
No, but in light of the fact that it's JAMA, right? Journal of the American Medical Association carries a lot of weight. It's a high clout location, and that they are broadcasting on their website, even if that's just people who have clicked through and seen this conclusion deployed under that banner. That is an amazingly powerful fact.
Yeah. And so here, let me actually, just before I say something about what the paper finds, the sections of a scientific paper are generally abstract, introduction, methods or methods and materials, results, discussion, and then references cited. So the abstract is the summary, the author's summary of what it is that the paper finds. The introduction sets up the extant research, the background research, and the theoretical framing for the work that they're doing. The methods or methods and materials, whatever, describes exactly what it is that they did, hopefully with enough detail such that someone else could go in with the methods and redo their work, and thus effectively replicate that work. The results is just supposed to be a description of what they found, the analysis, having then done what they described that they were going to do in the methods. They did that, offsite, and then they describe the results, including the analysis, the statistical analysis of the results. The results is not supposed to include any interpretation. And then the discussion is exactly the interpretation. You sort of come full circle and you say, given what we thought we knew, given what our hypothesis was, hopefully, what is it that we found and what do we make of it in light of the other things that we know to be true? And then the references cited is just that. All the references that were cited to, in a paper like this, to make the sorts of decisions for how it was that they were assessing background numbers. So in this case, the abstract is a fairly detailed, so here you can show my screen again, Zach, is actually split up into several sections. And in the results section, they have, in conclusions and relevance, rather, in this decision analytical model of multiple scenarios for proportions of asymptomatic individuals with COVID-19 and infectious periods, transmission from asymptomatic individuals was estimated to account for more than half of all transmissions. In addition to identification and isolation of persons with symptomatic COVID-19, effective control of spread will require reducing the risk of transmission from people with infection who do not have symptoms. These findings suggest that measures such as wearing masks, hand hygiene, social distancing, and strategic testing of people who are not ill will be foundational to slowing the spread of COVID-19 until safe and effective vaccines are available and widely used. So let me say, just with regard to that last sentence, that regardless of what else might be true about this paper, we have been, since our very first live stream in late March, at the point that the WHO and the Surgeon General had, were recently arguing that mask wearing was not useful at all, advocating for mask wearing and hygiene and, social distancing and all of these things, right? But this paper effectively claims to have finally done the work that a lot of people have been looking for, and has found this really alarming result that over half of the cases are actually spread due to asymptomatic individuals. And they're careful here. They specify that there are three classes, that there are symptomatic individuals of people who have tested positive, there are symptomatic individuals, there are pre-symptomatic individuals, and there are what they're calling never symptomatic individuals. And they're trying to tease apart the pre-symptomatic from the never symptomatic. The idea being the pre-symptomatic, there's really low reason to expect that they will be much less transmitting of disease, although perhaps somewhat. So this is really bad news, right?
You said it's alarming, but I also want to separate that from surprising. So again, people who've watched us will know this piece of logic, but
What piece of logic?
the idea that it would be surprising to have a very high rate of totally asymptomatic transmission. And the reason is that the very things that allow a virus to be transmitted are the things that cause symptoms. That is to say, if you imagine, for example, cells in your lung that have been invaded by a virus that are now spilling forth virus to invade other cells and to escape into the environment, then that's a piece of damage in your lung that will cause irritation, will cause mucus, etc. So the idea is, typically speaking, you would expect symptoms to be correlated with the degree of illness and therefore the degree of infectivity. So this is not only a shocking result at the level of, oh my goodness, this is a very dangerous phenomenon if that's true, but it's surprising at a scientific level.
Yeah, it is. Luckily for us, the paper is complete garbage. I mean, it's really actually stunning how much complete garbage is in this paper. So I could spend several hours going through the garbage nature of the paper, and I'm not going to bore everyone with that. It is going to be a little bit numbery here.
So you're going to condense down the garbage in this paper, making you a trash compactor.
Yeah, that's right. That's what I am for today, a trash compactor. My God. And so my intention here was not to dunk on this paper. I clicked on this link in the JAMA newsletter. The title again is SARS-CoV-2 transmission from people without COVID-19 symptoms. And it looks really alarming. And the fact is, I read this actually as I was making dinner last night, which sounds like a strange thing to do, but it was possible given the dinner I was making. And then I read the references that they had used to support their assumptions. And I came to dinner kind of alarmed. And then I read it again. And then I read it again this morning. And it just, frankly, it gets more shoddy, more clearly shoddy the more times you look at it. So
well, hold on, I got to jump in again.
Yeah.
So I also want to point out how unusual that behavior is.
Which behavior?
The behavior you just described for yourself with respect to this paper. And I just want to say that for various reasons, some of them totally mundane, very frequently people end up repeating. They will read an abstract of a paper, maybe they scan what's in the rest, and they will report based on that as if it's true, rather than saying, wow. And in fact, one of my advisors, Charles Handley, used to joke, I think maybe it was widely said in his era, may all your abstracts come true, right? The idea being that, an abstract is not an indication that the work is necessarily...
Well, I mean, this is not at all what we're supposed to be talking about here, but I suspect, I was not there to hear Charles say that. In fact, I don't think I ever even met him, but my suspicion is that was about you having to write an abstract before
for a talk,
preventing your talk at a conference. So you have to write what you think you're going to find before you've even done the research for a talk that's going to be given 9 months in the future.
That's true. In fairness, he was referring to that in the particular case. I will say, though, that the number of times that what is in the abstract is not justified by what is in the paper is alarmingly high. And therefore, one has to, it's one thing if you're looking at somebody whose work you know very well and you know that it's careful, and then their latest paper comes out and you look at the abstract and you say, this person found that, right? But it's another thing to just take some piece of work you know nothing about and assume that what's in the abstract is justified by what's in the paper. It's very commonly not. And yet, as soon as something, especially something sensational, emerges in the form of a title in an abstract, it will be cited and repeated, and there's no way of knowing.
Almost no one is going to actually have read the paper, much less a few times.
Much less multiple times,
Excuse me. Much less have gone through and figured out and read the sources that they are citing, which is the part where I said, okay, they're just not doing good work here. So let's go through it as briefly as possible. So this paper is a model that's then based on some combination of empirical research and review papers and models themselves. So what are these terms again? Since we've already defined sort of what the parts of a research paper are, a model is trying to generate a predictive basically equation or set of equations that will reveal something that is true about the universe, having fed in some actual data, and then hopefully the model has enough general predictive value that you could take it to a different system, either a different place or at a different time, or maybe even a slightly different, in this case, disease possibly, and say, okay, what would you have to tweak to have this model continue to be true? So this paper is just describing a model and the results from a model. There's nothing empirical here. Empirical meaning they went out and they actually took data. They actually measured data themselves, made measurements themselves, and brought that data back into the analysis. And then there are also review papers which go into the literature and say, okay, I've got, I found 8 papers that are relevant to the thing that I'm trying to figure out. Let me do a meta-analysis on those and see what, if I take them in the aggregate, they might find. So this is a model that's based on some combination of empirical research and review papers and aggregates.
So it is a model they have developed from empirical work.
Somewhat from empirical work,
okay.
Not entirely from empirical work. But so that's, fair enough. That's done broadly. We have critiqued models and modeling systems in the past, and we will continue to do so. But models aren't inherently flawed, right? You just have to understand that it's not the same as empirical research. In the results of the abstract, so again, the results section, and this is not the results section of the paper, but the results of the abstract, the results section is supposed to include only what it is that they found. They say, quote, the baseline assumptions for the model were that peak infectiousness occurred at the median. Let me start again. The baseline assumptions for the model were that peak infectiousness occurred at the median of symptom onset, and that 30% of individuals with infection never develop symptoms and are 75% as infectious as those who do develop symptoms. So they have just told us, in the results section, no less, of the abstract, that they used assumptions of 75% infectiousness of asymptomatic individuals in building this model, which then popped out the result that asymptomatic individuals are responsible for up to 50% of cases. This is a problem. This is a big problem. So on what basis did they put that assumption of 75% infectiousness of asymptomatic individuals into this model, which proclaims to actually find asymptomatic transmission, when what we've just been told in the actual results of the abstract is that that was an assumption of the model. So in the method section, the actual method section of the paper, they clarify this way, quote, we also made a baseline assumption that individuals with asymptomatic infections are on average 75% as infectious as those with symptomatic infections. Oh, wait, that's not clarifying. That's just a repeat of what they already said, except at least it's in the proper part of the paper now. They're acknowledging that this is the methods. This is something that they actually fed into their model. They then cite for this claim. How is it that they generated this number? 75% of asymptomatic individuals are 75% as infectious as symptomatic individuals. This is, again, not a finding of this paper. This is an assumption they used to build the model. They cite references 9, 15, and 16 to support this. So I went and read references 9, 15, and 16. We'll return there. But in the meantime, before we get there, recognize that everything downstream of this assumption, absolutely everything downstream of this assumption they use to build their model, this assumption that asymptomatic individuals are 75% as infectious as symptomatic individuals, cannot reveal anything about whether or not individuals are actually infectious because they've built that into the model. Everything downstream is suspect. They've built the assumption into their model.
In fact, they can't find anything else because they've built it in. It's circular.
There is no way for them to come to a different conclusion. Absolutely no way. Okay, so their results are holding the day of... actually here, I'm going to show this figure in a minute when I find it, Zach. Okay, here we go. Zach, if you can show my screen. So this is figure 1. This is, it seems super mathy and very confusing.
Looks
and all this. Oh, it looks very sciencey, yes. Yeah. So figure 1, the contribution of asymptomatic transmission under different infection profiles. We are going to, for the moment, actually for the entire duration of this podcast, skip down to the second row, D, E, and F, about which they say panels D, E, and F show different proportions of transmissions from individuals who are never symptomatic. let's see. In D, we have baseline 75% relative infectivity, and E, 75% relative infectivity. And in this one, they did change the relative infectivity. So they have changed their baseline assumption here to 100% relative infectivity. They went right up to like asymptomatic individuals. We're just going to assume that asymptomatic individuals are exactly as infectious as symptomatic individuals. And we are going to be shocked, totally shocked, when our model produces a result that says that asymptomatic individuals are close to as infectious as symptomatic individuals. How does this pass for science? I just don't, I cannot believe that this got through anything like these scientists' brains or peer review or anything. So, okay, Zach and I have, thank you. How did they arrive at this number, the 75% baseline assumption? And then on what basis are they claiming to have messed with their assumptions, but actually only ever changed it in the upward direction? They only ever decided to look at 75% as infectious as symptomatic cases for asymptomatic, or 100%. Those are the only two numbers that they actually looked at. Well, the authors themselves show in, okay, once more, Zach, if you would, in the methods section, this table, key assumptions and evidence informing those assumptions. And here we're going to look at the section right here, relative infectiousness of individuals who never have symptoms. And here we have these three references again. Lee et al., which is reference 9, they say they looked at 303 patients and found approximately 100% as infectious. Wow, okay, then 75% seems like a decent estimate, okay. Cha et al., 2020, which was their reference 15, this paper says they looked at 1,701 secondary contacts and found an infection rate of asymptomatic compared to symptomatic individuals of 40 to 140%. Wow. Okay, that's asymptomatic individuals are more infectious than symptomatic individuals according to this paper. Better go look at the paper.
Curiouser and curiouser.
Curiouser and curiouser, yes. And then the third reference that this Johansson et al. Paper looks at is McAvoy et al., which is actually a modeling paper itself. Actually, it's a review paper that tries to do some modeling, and they found a mere 40 to 70%. And from those three numbers, these authors concluded 75% is about right. So, well, let's see if any of those numbers hold, right? Let's see. What we have in, there we go. Nope, hold on, Zach. Thank you. In Lee et al., what they did was they looked at 303 actual patients in a health center in South Korea. Cool. It's empirical. This paper finds compellingly that viral load in asymptomatic patients is similar to that in symptomatic patients. Okay, and this is not the only paper actually to have found that viral load is similar in asymptomatic patients and symptomatic patients. But guess what? Viral load is not the same thing as infectiousness or transmissibility. It's just not. It's not the same thing. And the authors of this paper, Lee et al., which are cited by Johansson et al. To support their ridiculous claim that 100%, so this Lee et al. Paper, Johansson claims 100% as infectious for asymptomatic versus symptomatic patients, say, quote, although the high viral load we observed in asymptomatic patients raises a distinct possibility of a risk for transmission, our study was not designed to determine this. Mm-hmm. And under the limitations of their own work, they say, quote, we did not determine the role that molecular viral shedding played in transmission from asymptomatic patients. So takeaway. One of those three references that Johansson et al. Find doesn't provide any evidence of transmissibility, much less 100%. Okay, that's one. We are going to get through these other two pretty quickly. Reference 15, Cha et al. It's an empirical paper tracking cases in Brunei following a super spreader event in Malaysia. So Brunei is a small country. There was a big event, like 16,000 people, religious event in Malaysia. Some number of people came home to Brunei, and small country with a lot of track and trace possible. And so they were actually able to look at what happened. So another empirical paper that's pretty well done. Actually, I was pretty impressed with this. It's complicated analysis with a lot of variables. And just a reminder that Johansson et al. Find that this paper found 40 to 140% of cases 40 to 140% of asymptomatic cases. No. Asymptomatic cases are 40 to 140% as infectious as symptomatic cases. That's what Johansson reports about this paper. Well, what does this paper actually find? It finds that in the household setting, which is the only settings where they could find anything statistically significant, symptomatic case patients had 2.7 times the risk of transmitting SARS-CoV-2 as combined asymptomatic and pre-symptomatic patients. So that's a conservative number. So, again, sorry for all the numbers, but almost 3 times as much infectiousness in symptomatic patients versus the combined asymptomatic and pre-symptomatic and never symptomatic patients. And when you look further into their paper, you find that, of course, the pre-symptomatic patients are more infectious than the never symptomatic patients. And what you don't find is any evidence for 40 to 140%. There's nothing in this paper at all that suggests that asymptomatic patients are more infectious than symptomatic patients. So where are they getting these numbers? Quickly, just the last paper is a review paper, and they're doing it carefully. It's a review only through April 8th, 2020, so it's early in the pandemic, which separates out never symptomatic from pre-symptomatic cases, and it's a careful review. And what they do is they say, we can't tell. There's not enough out there yet. The literature is not rich enough. There's not enough empirical work. We simply can't tell. And they specifically point to variable definitions of what infectiousness means. And they say, okay, so very tentatively, given that we think that maybe asymptomatics have about a 0.4 to 0.7 rate of infectiousness to that of symptomatics, which is exactly the number that Johansson cite here. And if you could just show my screen one more time, Zach. Once again, we have these 3 papers that the new Johansson paper is basing their numbers on. Lee et al., which was from South Korea, which actually has, in my finding, no evidence at all for transmissibility. And Johansson says approximately 100%. Cha et al., which was the case from Brunei, which, as far as I can tell, shows a third or less asymptomatic patients are a third or less infectious as symptomatic patients, and they say 40 to 140%, on the basis of which I cannot even begin to figure out. And McAvoy et al., which is a highly tentative number, says 40 to 70%. Well, that number they actually got right. You can see that here. They actually got that number. They pulled it directly from the paper, and it's right there. So my conclusion from all of this is that Johansson et al., this new paper, which I expect to start seeing reflected in, in the CDC's guidelines and various health officials' recommended behavioral changes, is that their baseline assumption of 75% infectiousness of asymptomatic relative to symptomatic cases is completely unfounded. Completely unfounded. And it's possible, but we literally have no evidence for that in the papers that they cite, given that nothing in the conclusions of this paper should be taken seriously, no policy should be based on it, and we should seriously question any of the work that these guys are doing going forward, because what the hell were they thinking?
So can you go back to the title of the piece?
The main one?
Yeah.
Yeah. SARS-CoV-2 transmission from people without COVID-19 symptoms.
So I think, I'm wondering whether our longtime viewers are having a bit of deja vu, because if you allow yourself to squint at this just right, it is very much like the situation. And unfortunately, I didn't realize until we were on the air what the parallel was, so I don't have the name of the paper. But the paper that declared IDW part of a mechanism of online echo chambering has the very same nature, in which they build a model that creates a shocking impression of a particular hazard. And when you go back and you scrutinize what it is that allowed them to build the model, it is in fact perfectly circular. They built into the model something that allowed them to pull that conclusion out. And in fact, in that case, we had the author of the article on which their assumptions were based saying, hey, you've misused my work. Yep. So it is exactly the same form, which then raises, I think, a very interesting question, which is, why are we facing an epidemic of this style of science?
Who is served by this?
Well,
who is served by this?
I think I
Either
know.
who are they working for, or why are they this confused, or why are they this bad at actually understanding how it is that you build a model that can produce a result that isn't exactly what you fed into that model?
I believe the problem is that we are up against evolution. What's happening here is
That's
that
not very helpful, is it?
it ought to properly frighten us and get us to wake up, because first of all, it's mundane, but realize that positions in academia, for example, are scarce, and therefore competition to get them is ferocious. And the way one gets wins that competition is to publish a lot of stuff, publish stuff that gets cited by others, etc. So in some sense, there's a niche. If you can say things that people will parrot, you're going to do well. And in fact, we see this. If you look at, citation rates and how they affect getting hired, it's spectacular, even when you're being cited because you're being mocked, right? In other words, the fact that your paper is cited a lot by people saying this isn't true doesn't necessarily count against you. So what I'm getting at here is, I don't know why this is showing up in JAMA, right? That's shocking and dangerous, as you point out, because policy is almost certain to be founded on this. But what I suspect is, privately, as we've seen in many different places in the SARS-CoV-2 COVID story, there is a behind-the-scenes consensus about what wise public policy is.
Yes.
And then the facts are rearranged around it to make it look like it is also in your interest as an individual. And so the idea that we have a large amount of transmission from people who never show symptoms, of course, is justifying of a lot of the most draconian measures to prevent the spread of COVID-19. And in any case, what that means is that people are looking for evidence that we need to do that. Those who have concluded, for whatever reason, responsible or not, public-spirited or not, those who want to impose those restrictions are looking for things that justify it, and this paper is liable to be confirming of their worldview, correct or incorrect. And so, in any case, I guess what I'm saying is you've got authors searching for that which the audience demands, and this is, as politics is the opposite of patriotism, giving the audience what it wants is the opposite of science. Science is supposed to tell you what's true irrespective of what you want to hear. This isn't science. It's circular, right? The point is, it looks like science. It's dressed up as science, and it is presented in a science-y place, and that is going to be enough to drive policy.
Yeah, it sure is. And